Our benefits committee is made up with representatives from all 7 of our unions, as well as non-union, and it's in our bylaws that that group has to approve anything we bring to the board. So it had to be a group decision to do this. I think what made the deciding factor for me to bring it to them was that it's everything they have now. So if you choose not to use any of these new pieces, if you choose not to use HELPcare Clinic, with our program, our more medical insurance part of our program, there are, let's say, preferred providers that you go for a zero cost. If you didn't want to use any of those and you still want to go to Mayo Clinic for every single thing I've done every year forever, it will cost you $0 more than what you're paying now, except I'm not going to have to give you the 12% premium increase that I would have had to give you. Literally, by going through this plan, we were able to have premiums be at either a 0% increase or a premium decrease for all employees. So, if you do nothing different and your premium's the same or lower, why wouldn't I? And so it really is best for employees. It's fantastic for our taxpayers. We're estimated at saving about $750,000. And that's just on the county side. So what's not to like about that? But things that people are saying is my actual provider spent an hour with me, talking with me. I spent more time with my doctor than I did waiting, which I've never experienced before. They do this, what's it called, Lee? It's the
The in-body? The in-body
body.
body composition, yeah.
Body composition is giving me more information. The blood tests they're doing were giving me information I never had before and didn't cost me anything, because your physical is always free, but that doesn't mean all your labs are. So even though you go on your regular health plan, even though you go for your annual free physical, that doesn't mean that you're not going to still get a bill for a whole bunch of labs. And heaven forbid you talk about something else, because now it's coded diagnostic. Now it doesn't get covered. And now it doesn't matter.
Hey, Lee Acey from HELPcare Clinic, your host for Take Charge with HELPcare, and here with Dan Hinman, my co-host, and our special guest this time is Kris Cohn. Kris is the HR director for Mower County. I got to know her over the last 10 months or so, 10, 12 months, as we've been working on putting the Mower County health plan together that includes HELPcare Clinic membership as a foundation, as part of it. So thought it'd be great for us to have a conversation today to introduce Kris and kind of the work that she's done in helping to navigate through a complex system like this to put through a change to help get a change accepted that's going to make a pretty significant difference for taxpayers and for employees. So, Kris, thanks for joining us.
Thank you for having me.
So great to have you here, Kris. I've really been looking forward to this interview. Leah's spoken so highly of you in this collaboration.
Thank you.
It's great to have you here. Why don't you start, Kris, by just telling us a little bit about yourself, your background, what brings you to this point today?
Sure. Well, I am the Human Resources Director for Moore County in Austin. I come from being the HR person previously for 10 years from Fillmore County. So county HR is in no way new to me. I was also the HR for TSA for 3 airports when they were first rolling out following 9/11. So I have a lot of experience in public sector, a little over 13 and a half years in county government. So very versed in the unique needs of public sector, public employees, and being good stewards of taxpayer dollars, as well as providing, the best possible health plan and coverage for our people that do the work. I worked with TSA when it was really, really new and there were no offices. We had 8 people in 2 shelled out hotel rooms because they hadn't even built our offices yet. And I had Rochester, St. Cloud, and La Crosse airports, and these screeners were just doing amazing work under really tough circumstances. That was my introduction to public sector.
Wow, great background and experience there. So what brought you to Mower County?
It was a very difficult decision to leave Fillmore County. It's the county I live in. I love it very much. Moore County is just something special and unique. This county really gave me an opportunity to use my skills and ability in what I would call no box thinking. I always tell people I don't like out of the box thinking because then people stay right around the edges, but I prefer no box thinking and to really make a strong impact in a larger county and just bring my skills and abilities to this area.
Oh, I love that idea about no box thinking. That's a great way to say it. So, thinking of no box thinking, what are some of your main priorities as an HR director?
Obviously we have the core HR pieces. We've got hiring, recruitment, and with that, trying to make sure that we are an employer of choice, as opposed to an employer of convenience or necessity. So we really work hard on employee culture, employee development. We work on ensuring that we are making ourselves um, available to everybody, that we're hiring the best possible people and giving them the tools they need to thrive and not just survive. So that's a big part of what I do. I do a lot with employee development, helping people have tools to grow and excel and continue growth and continue learning in their positions. Another big part, of course, we have 7 unions. I do a lot of work with our union employees, and I love working with our unions. And then we get to benefits, and so it's a very tough job market out there. And so benefits is a key piece in not only recruitment, but in maintaining employees. And so ensuring we give the best possible benefits while being stewards of taxpayer dollars, it takes a lot of time and effort. And I think we do that pretty successfully here.
Yeah, benefits are certainly a key part of what you do. And I'm thinking about how expensive healthcare benefits are becoming, continue to just rise. And so, what are some of the things you do in your role to help manage those healthcare benefits so that the taxpayers get the best use of their dollars?
Well, I'm fairly versed in benefits. And so I can be a bit of a data junkie, and we had previously been a part of a co op, which a lot of counties in Minnesota and cities are a part of to try and get more competitive pricing as a larger pool. I pretty much never take a first offer. So, any vendor that's ever worked with me, Lee included, will know that I kind of have my story that I tell everybody. I'm like, before you give me a price, know that every dollar you're asking me to spend, somebody got up, went to work, and paid their taxes so that I had it to spend. And I know someone
I
that
can
you have
testify
probably
I
at
heard
least
that.
once complained about how, I know that at least once you've complained about how the government spends your money, and that's not going to happen on my
Yeah.
watch. So they all know my shtick. But we also look at, again, no box thinking. And that's kind of how we got to the health program that we have now, right? So we look at, are we just offering a health plan, a medical plan, or are we offering a full health program that potentially can save our taxpayer dollars, our people dollars, and best of all, provide even superior abilities for them to stay healthy? The best way to keep costs low in a health plan is not to need to use it. And so, how do we help our people and their families be healthier so they don't need those services as much and can meet their wellness goals?
Yeah. So, this would bring up then how did you actually approach or come to know about healthcare clinics?
I can tell a little bit of that start of the story
Yeah,
because
great.
I was in a Chamber of Commerce book club that was called Leadership Reads with Trish Heron, who's the county administrator there. And, we read different books on leadership in different areas over one book per month and met on Friday mornings. Anyway, there was one particular time, and I suppose it was a year and a half ago, that there was one of the books that had a big section on healthcare. And it turned out that Trish and I were the ones who kind of had the most to say. She had some of the most experience too, and we were doing something, interesting with this. And I had my experience of having worked at Mayo Clinic as well. And so we both we dominated the conversation, but not in a bad way. It was just like everybody was just really thinking this was good. And afterwards, I came up to Trish and I said, I'd love to talk with you about whether we could put together a plan that would be, include membership with us, but that could help save some money for the taxpayers too. And she said, well, we've got this employee benefits committee and they talk about how they can maximize their benefits. And some of them had even been asking a little bit about, could we do something with HELPcare Clinic? And so it was probably a couple months after that I reached out to Trish and said, I think it was May of last year. I said, is it time to maybe get together and start talking about this? And so that's when I first met Kris, is that we had a gathering with our friends from Northwest Partners plus Kris and Trish to kind of talk through, at least introduce the concept.
Yeah. And what was your response the first time you heard about this, Kris? What were some of your thoughts?
I was very intrigued. I liked the idea of, this is a whole program. Again, it's not just health insurance. This is a health and wellness program that meets a lot of different areas. And it was innovative, and I'm all for innovation. We all know I have been fighting for years on the costs of health coverage for people. And so I was very intrigued. I mean, I asked 5,422 questions and 7 meetings, and every one I had another 5,422 questions. Because if I'm going to put my name and recommend this, to our benefits committee, I need to feel really good about it. And so we had a lot of meetings, and then we do have a great benefits committee. And so we started with just having the conversation and left our current provider still on the table. It wasn't this is what we're doing. This is we can do what we know and pay this, or we could explore this as an option and let's talk about it. And we've actually spent a lot of time educating our benefits committee. So that really made a big difference in this whole process.
Yeah, I think this was huge. This was not pulling together a benefits committee for this purpose. That benefits committee had been meeting before and had been having input and been understanding that whatever they can do to maximize the value is good for them and good for taxpayers too. So, and I think, so a little bit of our history that then Kris and Trish had us meet also then with the finance subcommittee of the county board, because there really wasn't any point in us developing a whole plan unless they were interested in exploring it and were willing to do that. And then they had us, I remember it was July 25th because it was my brother's birthday, that they had us in to do a presentation for the benefits committee and to get them, having a chance to hear what HELPcare Clinic membership's all about, how this might work with a health plan to create overall savings, plus give a lot more access to care. And they approved going ahead with checking out, with at least putting together a proposal. And so that was really important to get there, to not just come in at the last minute and say, hey, here's this option, but there was a long conversation process leading up to it. And Kris working with the unions, with the other employee representatives, I think was really huge.
So, Lee, how do you go about developing a customized plan for a situation like this?
Yeah, well, I think the foundation for a plan like this is a direct primary care model, because it enables the employees to get care at no cost, nothing out of pocket. They know that anytime they come to us, that it's going to be free to them. That's, 0 is a great number, and free is a great a great price. So, but it is, if you just add the direct primary care membership onto a regular plan from, Blue Cross Blue Shield or Aetna or Cigna or something like that, they're not going to give you credit for it. Like, they're not going to recognize the value of what you're providing. And so it takes an insurance advisor, not just an insurance broker, someone who's willing to really take the side of the client and say, we're here to help you get the best package, and not just have you continue renewing with the group that we had last time. And so we were really grateful to be able to work with our friends with Northwest Partners. They have that mindset. And I think they came up with a pretty great approach to it, where they said, we don't want to just go, this is a lot of work. First of all, it's really easy to just check the box and say, I wanted same thing I did last year. I want just your off-the-shelf plan. However, what they said is, we'll develop this plan, but we don't want to just develop a plan and then have you say, okay, we'll go have somebody else do it. So they said, we'll have a fee for developing the plan, or otherwise you can just sign it over to us right now and we'll be your agent of record. But they said from the county's perspective, it was safer for them to say, this is worth exploring because the payoff is really pretty big. But anyway, what Northwest Partners said is, if we don't generate at least 10 times the amount of savings, 10 times what our fee is in savings, we'll refund the fee. So it kind of is a no-lose situation there. Wow. A guaranteed 10 times your money kind of thing. And that's what we did. And that took a month and a half or so, I think, to kind of go through that. Because then at that point, the county has to provide data. And from there, because the insurance underwriters need to know kind of what kind of a population they're getting access to.
And Kris is pretty particular in what she wants for her people.
Yeah.
So, what was the deciding factor to you, Kris, in bringing on this innovative idea for your employees' health?
Well, I think it's important to note that it wasn't the deciding factor for me. Our benefits committee is made up with representatives from all 7 of our unions as well as non-union. And it's in our bylaws that that group has to approve anything we bring to the board. So it had to be a group decision to do this. I think what made the deciding factor for me to bring it to them was that it's everything they have now. So if you choose not to use any of these new pieces, if you choose not to use HELPcare Clinic, with our program, our more medical insurance part of our help program, there are, let's say, preferred providers that you go for a zero cost. If you didn't want to use any of those and you still want to go to Mayo Clinic for every single thing I've done every year forever, it will cost you $0 more than what you're paying now, except I'm not going to have to give you the 12% premium increase that I would have had to give you.
Yeah. Yeah. I
So
mean, so everybody's saved no matter what.
because literally by going through this plan, we were able to have premiums be at either a 0% increase or a premium decrease for all employees. So, if you do nothing different and your premium's the same or lower, why wouldn't I? And so it really is best for employees. It's fantastic for our taxpayers. We're estimated at saving about $750,000. And that's just on the county side. So what's not to like about that?
Yeah, well, and then what I will say is that so far we've seen about 240 of the 670 plan members. So like 34%, a little bit more than that.
Which for the first
For
year is very high.
It's really very high. I mean, it's in the first 3 months, that we've done that, and they've paid $0 for any of the care they got from us. So in the old plan, and for the people that are doing, still going in the old road, they're having, deductibles and they're having copays and things like that. But when they're coming to us, it's free. And so we really believe, the way this works is that as people talk among the employees and they say, yeah, I went there and it was really convenient and it was free and friendly and nice, and that's going to grow. And then as that happens, then the savings for the county and for the overall plan increase because they're going through the lower cost, high personal touch kind of provider instead of the big system that just costs a lot more.
So, what are you hearing, Kris, from how employees are feeling about this partnership with HELPcare Clinic?
Well, change is always hard. And so, there are some people that are going, okay, this is different. I'm getting used to it. I have heard so many success stories, frankly, including my own and my husband's. I mean, I've been there twice already for my appointments and have actually already started getting relief for some conditions I've had since I was 16. And I'll just say I'm significantly over 16 now. But, things that people are saying is my actual provider spent an hour with me, talking with me. You know, I spent more time with my doctor than I did waiting, which I've never experienced before. They do this, what's it called, Lee? It's the
The in-body,
in-body
body composition. Yeah.
body composition is giving me more information. The blood tests they're doing were giving me information I never had before and didn't cost me anything, because your physical is always free, but that doesn't mean all your labs are. So even though you go on your regular health plan, even though you go for your annual free physical, that doesn't mean that you're not going to still get a bill for a whole bunch of labs. And heaven forbid you talk about something else because now it's coded diagnostic. Now it doesn't get covered. And now it doesn't matter. I mean, my husband and I have the same provider. So literally in the same visit, we're talking about how both of us and how it relates. And we don't have to worry about how it's coded because it's 100% covered. So yeah, we've had a lot of positive feedback, a little bit with, we're 3 months in to a whole new way of looking at things. I think the biggest confusion was people thinking that healthcare clinic was the medical insurance. And I think that's where we've had to have the most communication, helping them understand that healthcare clinic is a part of the overall health program that includes medical insurance, that includes healthcare clinic, that includes some other things like nurse navigators and all those. And I think that was the biggest piece of communication we probably did the most.
Yeah, interesting. And so how do you help the employees navigate this education piece?
Well, we have done a lot of communication. We send out different bits on different parts of it. We did a lot of communication up front. We have always held in-person open enrollment meetings. And so we spent a lot of time talking about that. And even
We had an
now,
open house. Yeah, we had 2
we
days
had
of
an
open
open
house
house.
at
Yeah.
the clinic for people to come in and sign up to get their first appointments and their lab tests,
Yep.
blood draws scheduled. So
And that worked really well. And even now, my department, I'm very customer focused, and my customers are my people. And I would say my people, they don't report to me, but they're mine. I am very caring about all of my employees. So I would say my people, but we are very hands on. And so if somebody has a problem, we don't say, well, call so and so. We go, okay, give me your information. Let me look into that. And so we do very hands on customer service with our people to help them resolve issues in right now time. I mean, Lee and I just had one a week or two ago where someone had an issue, and I picked up the phone and called Lee and said, there was some glitch, a dependent didn't get in the system and they need to be seen today. And I called Lee, and within 30 minutes, that person had an appointment to get their child in. And so, but we can do those real time things that really makes all the difference.
And Lee, how have you liked working with the county folks so far?
well, it's just really been fantastic. I mean, it's been great. Kris and Trish, just in terms of navigating this, and then the county board being, forward thinking on this and saying, hey, this is the first county in Minnesota to do this. Mower County is leading. They've been great. And, we just appreciate that, like that partnership, and that recognizing that we're all on the same side and we're trying to help people get and stay healthy. And there are some people that aren't maybe as ready for the lifestyle change kind of stuff to be able to do that. And we'll meet them where they are too. Like, we're just there to, the main thing that we're focusing on is they're the driver. We're the navigators. We're here just to help to point out some things that might be helpful, but they're in charge of their health. It's that Take Charge is the name of our podcast. I mean, that's what we do. That's the idea. And I think in this case, Kris took charge of the health plan. Kris took charge of, by exercising the ownership on it, stewardship for the taxpayers and for the employees, help to navigate to something instead of just saying, well, it's going up again 12% this year. To be able to say, well, let's do something about it and let's work together. So it's really been exciting from my perspective.
One of the nice things I just want to note with this entire program, and I really do focus on calling it a health program as opposed to our health plan, is that our employees don't pay a medical premium and a healthcare clinic premium. So we embedded, when I say that there was a 0% increase and or a decrease, we embedded the membership fee for the healthcare clinic right into the premium. That zero and that negative includes adding the cost of a healthcare clinic premium. And we were still able to realize those differences for our people.
Yeah, that's where people kind of think it sounds too good to be like, how can this be? And it's like, you're getting all this extra care, like my lab tests are free and everything, and my office visits are free, and it costs less than last year.
Mm-hmm.
But it's the reality.
Well, not only less from last year, but saving maybe $750,000 for the health plan overall.
Yeah.
Yeah.
So
We
it's
have one option for our employees. One of our employee plus children options is a 50% premium reduction from 2024. That's significant money to a family.
yeah,
Yeah, a
yeah.
lot more take home pay.
Mm-hmm.
Well, maybe we could just summarize then what the benefit is to the employee to be able to receive care from healthcare clinic.
I think the benefits are one, our employees all work right here in Austin. And so they are able to go and get appointments where they are the center of attention. They're not being moved through, and the average appointment's 7 minutes in most health places. They are the full attention. So they're able to actually have conversations about their health. without worrying about what they do and don't say. They are given multiple options on how they want to manage their health, be that medication, be that more holistically, be that diet and exercise, whatever that may be. They are able to not have to worry about whether I should go to the doctor or not because they haven't met their deductible because there's zero cost. I haven't touched my deductible yet, and I've been to the doctor multiple times. So we've taken away a lot of that worry and been able to provide excellent service and another option for people. They're not required to go. It's an option for them to be in the driver's seat. So this is really when they moved to, the high deductible health plans and all that. This really is more true to what that was intended to be than what it turned out to be when big medical and big pharma got a hold of it. And so this really is the more true version of what being the driver of your own health is.
I love that summary. And so then another question for you, Kris, would be if an HR director in another county or government entity was interested in reducing healthcare costs or looking at innovative ways, what advice would you give them?
I've already gotten several calls. So
Hmm.
um,
Good.
I really tell them that, if they have the ability to work with the DCP in this kind of program, I highly recommend it. We have already seen such savings and we have had such positive feedback on the level of care that people have been able to receive. And again, we're not saying don't go to Mayo Clinic. We
Mhm.
love Mayo Clinic. They have absolutely their place in all of this.
And they're an in-network
And
provider, just same as last
they're
year.
an in-network
Yeah.
provider. Yeah. So they're still an in-network provider. I'm not saying don't do that. What I'm saying is that, if you're willing to do some no box thinking and not assume that, well, I have to have Blue Cross, Health Partners, Medica, all of these big pieces, we are truly self-funded. That if you have the ability to take charge of that, it's absolutely worth it. And I can give you a perfect example. Because we are truly self-funded, we had gotten a call from North Risk saying that there was an employee who needed a medication that they've been taking for years. It's an extremely high cost medication that they are able to work through a program to get this for them at no cost, but it's going to take about 30 days. Well, they can't go 30 days without their medication. So the question to us was, would you be willing to just pay the $13,000 until we can get this worked out? And in one phone call in 5 minutes, I could say, yep, pay for it. I don't have to ask Medica for permission. I don't have to see if Blue Cross is willing to cover it. We own the medical side. We can say, pay for it, keep me in the loop. And when that's done, and our employee had their medication that day. That's the power of being able to do a truly self-funded health program. And that made all the
So,
difference in the world to that employee.
so what was the cost of that? I mean, how much was the savings that it ended up being for the county with that?
Once they got through the program, we saved about $11,000 per month on that medication. We paid the $13,000 up front.
Yeah.
But they were able to get it for $11,000 less through their program by giving them 30 days. And our employee then, because of that savings, our employee pays $0 for that medication all year long. They used to max out January 1st, and they had their medication the same day. How do you get better than that? And we're saving the taxpayer dollar, we're saving the employee dollars, and they have their medication right now. It's not wait for the health program, just send it to their underwriters, just send it to their approval department. I'm the approval department. I can say yes. I have been given the authority to say, yes, that makes sense. Let's do it.
You are deputized to save money.
I am deputized to save money. Well, I say I am deputized to do the right thing.
To do the right thing, yeah.
That's what our county board really cares about. We need to do the right thing by our taxpayers. We need to do the right thing by our employees. And so they have tasked me with do the right thing. And I am accountable for that. And I am happy to do that every day of the week.
Amazing. Lee, any additional thoughts you want to share before we close the
Yeah, I just say it has been really a significant game changer for us as well, to be able to have a large population of new members, coming in. It really means a lot to us that we went through the process with the county, and that Kris had such a good process where the employee unions and the other employee representatives had to approve it. Like, it had to be something that they wanted to do. And they really, I think, have created a template that could be used in a lot of places. And we're looking forward to hopefully helping a lot of other employers in the same way as well. And Kris had mentioned earlier that she's already talked to some people. It's like, Kris, I want to talk to those people because part of our mission, is to help practitioners, help doctors and nurse practitioners and PAs who are kind of frustrated with the healthcare system too, to help them escape the matrix, so to speak, and to be able to set up their own clinics. And so in some of these other counties maybe that you're talking to, or other employers, we'd love to be able to help them set up a clinic like this, where we can provide the management services to kind of take care of the details so that the doctors and nurse practitioners and PAs can just focus on that relationship that you've experienced, that you've talked about, that, you have the hour to really get to know you get to know your practitioner, they get to know you, and then you're a name and not a number, and that's really what we're all about.
I think the biggest thing for other employers and other entities looking at doing this, I would really be remiss if I did not point out that none of this works unless we have, like Lee had mentioned, we had to have board support. And I could not be more thankful and appreciative for my county board. And you have to have employee buy-in. You don't have those two things, this whole process and this whole program falls flat on its face.
Mm-hmm.
And so taking the time to educate your benefits people, so that they understand when they see numbers, what those numbers mean. And so that they understand how things work together. It's not just an insurance card, all the things that go with that. And if you can have supportive leadership and employee buy-in, then you can have success. We estimated a 25% utilization of HELPcare clinic this first year, and we've already exceeded that number.
Yeah,
But it's through
that's fantastic.
buy-in and communication and education.
Well, Kris, this has been fantastic. So good to have you on the podcast today. We're excited about working with Mower County, with you. The whole process has been amazing to go through. And so thank you for sharing that with our listeners.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review, and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.